PTX 35 and its cognate receptor, TNFR-SF25, have the potential to work with other immunotherapeutics, specifically checkpoint inhibitors, but also potentially other immuno-oncology reagents to unmask or unlock the ability of CD8 positive T cells and other T cells to become activated. It is particularly potent in the induction of CD8 T cell memory. It also is most active when T cells are already activated, such as by antigen, and that has the potential to increase its specificity of stimulation. I think that looking at co-stimulatory molecules such as PTX 35 is an important part of building our toolkit.
There are distinct advantages to TNFR-SF25 because it is only expressed in T cells which have already been experienced an antigen or has seen antigen. And so this takes away some of the non-specific stimulation that's seen with a lot of the other T cell co-stimulatory agents. The checkpoint inhibitors are limited and unfortunately will not be the cure-all for all patients, and therefore we already know that combination therapies are the way of the future for cancer immunotherapy. And T-cell eliciting therapies is the obvious next step. What's next after that? And we believe that adding additional support for these incredibly important T cells that do the lion's share of the work in recognizing, reacting against, and destroying tumor, they are the critical element. But where we are in the field now is the use of a third agent that also helps support and expand those T cells, like co-stimulatory molecules, and specifically PTX 35 is a novel and innovative way of establishing the next realm of combination therapy.
This future of trying to turn cold tumors hot or otherwise stimulating the immune system is probably the most important area of immunotherapy today. PTX 35, I believe, is a novel approach, an innovative approach to try to stimulate the immune system, again, to see if we can do better than we currently do with the regular checkpoint inhibitors. And it belongs along with other agents such as 4-1BB, OX40, CD40, ICOS. These are targets where we're ultimately trying to pursue a way of improving the immune response in those patients who so far do not actually gain benefit from immunotherapy. The key thing first is to see, is there any chance for single agent response to drugs like PTX 35? Because some of these agents can induce a response. And that's important because it tells us that we've got a new avenue, a potential breakthrough designation if the drug works by itself.
Eckhard Podack became interested in co-stimulatory molecules of the immune system. One of those molecules, of which little was known at the time, was TNFR-SF25, a member of the TNF family. The opportunity to study the biology of TNFR-SF25 signaling, where it was important in the immune system, which led us to an understanding of its expression on regulatory T cells. Part of the future lies in combining the usefulness of regulatory T cells with other strategies and approaches to regulate the immune system. I think the opportunities to utilize our insights into TNFR-SF25 are basically unlimited.